And the Health Ministry wants to focus on extending the range and coverage of healthcare services to tackle chronic conditions and cancer. Its aim is to build on integrating care for the chronically ill, so their treatment will be managed on an ongoing rather than episodic basis. Vimita Mohandas with more.
GPs will now find it easier to follow up on care for chronically ill patients, all thanks to the CLEO system, which will facilitate patient information among GPs.
This system is supposed to be intelligent enough to give me reminders and prompt me to do certain things at certain intervals for each individual chronic diseases. So in case I'm too busy or my nurses forget to remind patients, or I forgot to remind patients or forgot to do certain things, the system prompts me so that our delivery of care will then be enhanced and improved upon.
Following up on patients' treatments has been a challenge for most GPs. But with the CLEO system, GPs will have access to the National Electronics Health Record, or NEHR system, which will provide them with an array of patient information. These include their current care received at other healthcare institutions, medication histories, or drug allergies.
They will do things in probably a more organized, systematic manner in terms of the clinical tools that will be used to help them. They'll find that they can find knowledge better, the more specific knowledge. They'll be able to look up references in a better way. They'll be able to track and manage the patients better. Many times, if you're in a manual world, just tracking is just not tenable.
With more GPs sharing patient information, patient confidentiality has been a concern for some patients. But GPs I spoke to stressed that before the information is keyed in, it must be agreed upon by all relevant parties and must be crucial to the management of their medical conditions.
Individual GPs must find out from their patients what they are comfortable and not comfortable with. That's number one. Number two, the GPs should also reassure the patients that their data, their information is confidential. Of course, within the legal parameters laid down in Singapore.
The ministry's goal is to roll out the NEHR system to some 10 GPs, a hospice and a nursing home by the end of this year.